Hello, everyone, and welcome to 1 in 6 Supports Montclair Friday group. We are here today with some very important people in our community. We have Dr. Trim, who is, Dr. Trim, who is head of pupil services, and we have Ms. Tameka Stafford, who is supervisor for special education. Okay, we are so happy to have you here. Ms. Turner, Dr.
Yes,
Turner.
certainly.
Ms. Turner has a family emergency, so unfortunately she's unable to be here today, but she is going to return. And our speaker said that they would be glad to come back with her. So this is something that's very important to everyone in the district. Immediately when we asked for their presence, they said, yes, we are happy to be here. They want transparency. I just want to let you know a little bit about our group. This group has been running since 2008, which is almost 18 years. And we are a group of parents who mainly in Montclair, but in surrounding areas as well. And this is a free group for practical and emotional support, how to navigate the school system, how to get what we need for our children. Everyone here has a child, at least one child with some kind of a disability from mild to profound. And we're just here to let have your ears to hear our questions and concerns and have your responses. We've sent you, just to make this flow more efficiently and easily, we've sent you the questions that we've received. We have a couple more that came in late that we can do at the end, but we're really grateful that you're here. We're going to keep this but there are a lot of frustrated parents, but we know we want to be respectful of you and the parents and keep this calm and productive and constructive. Which I'm sure it will be. So this is being recorded and we're going to send it out to our families. We have about 640 families. So this is just a subset of our group, but we're really happy to have you here. And let's take it from here. I think housekeeping, everybody knows where the bathroom is, and we're going to get started. So thank you, Dr. Trim and Ms. Stafford for being here again. And I think maybe we should, oops, what's there? Can everybody just make sure to mute yourself if you're on there? I think that was me that was just speaking for some reason. So could you want to give a little introduction about what you do in the district before we get to some of the questions?
Okay.
Like what your main role is?
Yeah, sure thing. Thank you so much for that. Thank you for inviting us. We're very, very happy to be here. As Ms. Schneider stated, Ms. Turner had a family emergency and she had to leave the district, I think on Wednesday. But the show will go on, and we're here. So I'm Siobhan Trim, Director of Pupil Services, and I've been Director of Pupil Services for a little bit over 2 years now. In my role, primarily I oversee, of course, special education. In the past, last year was also 504, but that has since been transferred to our Director of Guidance, Ms. Jennifer Griffith. I also oversee and nursing services and home instruction services.
And I am Tameka Stafford. I'm a supervisor of special education. So my role is I am K to 12. So I'm actually over the different district when it comes to dealing with instruction, but then I supervise the child study team members and related service providers for Glenfield. And now I was at Renaissance, but I'm transitioning to Buzz. I'm also the extended school year supervisor as well.
Okay, and so that's a little bit about us.
And I have to say this though, I'm a Montclairian. I'm a class of 1994 graduate. So thank you. So I have to give that disclaimer because this is also my home.
Absolutely.
Thank you.
Thank you.
Okay, so why don't we get started? We had a condensed version of the questions I think that we sent you. Should we you want to go from there? Yeah. Okay, do you have that?
I have a question, and then
Okay.
I just have just to keep notes or something additional that we need to.
Okay, so should we start with the first one that came through? Do you want to read that? And
Sure. The first question said, the headline is budget crisis. Parents are concerned that the quality of supports will suffer as increased strain is placed on remaining staff after cuts. And this will only get worse if the March vote does not pass and more teachers are cut and classes expanded. Some parents are already seeing problems with their supports. Question 1, how is this risk being mitigated? I'm gonna be very honest. The budget questions primarily Ms. Turner answers, but we can absolutely weigh in on this as well. So Ms. Turner has indicated that nothing with regards to special education, all services that have been mandated in the student's IEPs will continue. So and as of right now, that holds true. We have not lost any child study team members as a result of budget cuts. Um, we have not, well, I mean, we did, I know some special education teachers we lost, but what happened, that was because of bumping rights. And so there were other teachers who had the appropriate certification to instruct via special education that were placed in that position. Let me go back now. With regards to child study team members, we did two individuals, two social workers. They were bumped out of their positions because we had other individuals with the appropriate cert, with a similar cert, school social worker cert, who had tenure rights, so they were in the district longer, so they bumped them out of that position. And we began because they did not have child study team experience, so we started providing training before January 5th. So we meet with them regularly. They've been meeting with their teams. Well, they work with their teams on a daily basis, and the case managers that were previously assigned they transitioned with them, and matter of fact, they're still helping them on that end. But so with regards to cuts, like that was the extent of it. We did lose our MCS, Montclair Counseling Services program. So I don't know how many of you are familiar with that. So in the past, we contracted with ESS, Effective School Solutions. And within the past over 2 years, we've built our own. And we were so proud of it because it was like a homegrown program. It was really taking off, doing great things primarily at the high school and at Buzz. But because of the cuts like that, that wasn't like a special ed initiative per se. It benefited both special students with IEP, special education students, and our gen ed students. But we lost that. We did lose that support. Thank you. So that's question one. Question two: are you aware that some students have been without ICS teachers since break? So no, I'm not aware. And wrote asterisks here so I can address it.
What is ICS?
Oh, in-class support, but it's supposed to be in-class. It should be in-class resource. But it's so years ago, so they changed the name, but it was always in-class support. Like typically when you see that co-teaching model where you have a general education teacher and a special education teacher, it's ICS, but it's the code defines or calls it in-class resource, ICR. Ms. Stafford is very touchy about that because when I first started, it was ICS, and so I'm still having difficulty making the transition, and it's been ICR for a very long time now. But that's essentially what it is. Mm-hmm.
Yes.
I was just going to say that was one of my concerns.
Oh, okay.
So if you just need like further clarification.
Yes, please, because I'm sorry, because I'm wondering is it does it due to a lead that they have a sub or they don't have anyone altogether? Like,
yeah, so I reached out to the case manager, the ELA teacher also, because my daughter is very good at thankfully advocating for herself.
Mm-hmm.
So she went to the ELA teacher to speak about it. So I heard back from the ELA teacher, and then the ELA teacher had looped in Mr. Jennings and Ms. Gandhi, and Ms. Gandhi replied to me. So she said they had identified someone for the first period.
Okay.
But according to her email, someone in HR and CO, which I assume is central office, said that those individuals could not be used for that first period and that they would be following up. So it sounds like at Buzz, they're waiting for more direction and guidance from central office.
Okay.
And so that's where the sort of holdup is coming from.
Okay.
Yes. So
well, thank you for that. So when we get back to central office,
and it's not across the board. So she does get the support in all her core classes. So it does seem like for science and social studies, there is there is ICR in there, but of course for her math and ELA, which is really where she needs it, those are the two classes where she has not.
What grade?
She's 6.
Okay.
Yeah.
And Christina here, whoops, somebody has a message, question here.
Yes, thank you. So on that same vein, I had a similar instance at Montclair High, is there like a time limit for when, say, for instance, a teacher went on leave in a class where there's supposed to be, a general ed and then a special education teacher, and so the special education teacher is now kind of taken the lead, obviously, because she's also a subject matter expert, but then not yet another in-class resource has been placed. So sometimes there's a just general sub, like
Right.
random person sitting in the back. Sometimes there isn't one. Maybe the availability of actual substitutes. So then that one special education teacher, this is a science class, is covering, can be a challenging class at times. So, two people in the room is preferred, but especially, to kind of keep the continuity. It's a situation where I don't know when the main teacher is going to come back. She's, on leave. It could be a month, could be more. So,
Got
yeah.
it. Okay, so I'll respond to your question first, only because it's fresh on my mind. So what happens if the only way we can post for and hire for a long-term sub, that's when you have they're in the contract and you have the same teacher, same substitute for a significant period of time, is if the individual, the teacher who's on leave, submits the paperwork to HR indicating that they'll be going on leave. And what happens is, like, unfortunately, we don't always get that. So like they may not know right away that they're going on leave, and they take off like daily, like a day here or there. So as a result, we can't have a consistent person. So, but we are supposed to have a substitute in that class. It'll be a daily sub. And unfortunately, because it's a daily sub, the individual may differ. May not be the same individual the entire time. But what happens is, once paperwork is received indicating that that teacher will be going on leave, then HR posts for a leave replacement. The individuals, so at the high school, I know it's the APs, the principals over that department. They will then interview and then recommend that particular person for that position, and thereby having consistency until the individual who's on leave returns. So it may be that type of scenario in that case. With regards to Buzz Aldrin, the situation at Buzz Aldrin, if it's for a first period class and there hasn't been a teacher there for a while, and I think I do recall like some emails going back and forth with regards to the first period. What happens is HR should have already put in for a sub, either long-term leave replacement, somewhere along those lines. If that didn't happen, that could be we are having difficulty securing subs, and that was before the budget issue. I think after COVID, that's when things kind of like went a little haywire. Not just from Montclair, like in New Jersey, like there was a teacher shortage, which has continued, but now it's compounded for classes in Montclair as a result of the budget. I do also know that as a result of budgetary constraints, we had to decrease the amount that we're paying for subs, like their daily rate, what we would pay for subs and for paras. And so therefore we're not as desirable as a result of that, because typically individuals want to go to another district where they're going to be paid more money. So I know Ms. Turner spoke about that on Tuesday, and it comes out to this, so that's what's happening. So it is difficult securing sub, but regardless, the IEP is the IEP. And aside from the IEP, the needs of our students take precedence. So if a teacher is required, we have to provide that teacher. And if that doesn't happen, then the district is required to provide compensatory services, even for education. So what that means is, when I say, I'm sorry, instruction, because typically you may hear that we provide compensatory services for like speech or OT. The same holds true in this case, if there has not been a consistent teacher to provide the necessary strategies that our students require, then the district has to provide compensatory services. And that will look different in each case. So it's not like a one size fits all type of scenario. It depends on how many hours. Okay, what would that look like? Would that be like before school tutoring, after school tutoring, like maybe tacked on to like to an extended school year program? So I will be looking more so into that.
And then I just want to add, and this is just anywhere outside of Montclair, but just so you know, like when teachers put in to go on leave, like there's nothing that we can do about it, you know, on a central office or as an administrator. But then, like, let's say someone puts in leave for a month or 2 months, people don't want to pick up a temporary position when they're looking for full-time employment. So some people will say, I'll take the position if you can guarantee me a full-time employment for the fall. So that, just so you know, that that also is a barrier, no matter where you go.
But things can get extended too.
Right.
Right, and then we never know, and then some.
You're like,
Yeah, like perfect example, we came back on the 5th, and we came back to like emails. Oh, this individual's going on leave. Like it would have been nice if you told us beforehand so we could plan. But then we know things happen, right? Like life happens, and maybe someone like broke an ankle or something like the day of or the morning of. We don't know. So and then it takes time because like there's statutes for how long you have to post before the posting closes. And then you have to interview, and then you recommend, and then there's fingerprinting and background checks. But during all this time, a sub should be in the class. But again, it's a daily sub, which it's going to be different. So.
and it's like 60 days to release. So let's say somebody from a different district wants to come to Montclair, Yahoo, but then it's like if they're in another contract, then that district can hold them up to 60 days.
Right.
You know, so like we can't even make them come. The district has the right to either hold them or to release them. But because we're in this staffing crisis everywhere, districts are not willing to release people early because now they are then stuck with
Right.
a vacancy to fill. So
Yes.
that's just to add just some more information if you didn't know it.
Yeah, it's a difficult situation.
It's very difficult.
But then again, not just for Montclair, like, but
It's everywhere. I have family members that are in, I have like a cousin who's an administrator in special education in Georgia, and she's facing the same exact situation. They're actually worse, but that's another conversation for another day.
yeah.
All right, let's see.
Keep on.
Okay.
Okay.
So so the next question, is the district open to creating an email for concerns on this topic, similar to what Ms. Turner did on the budget issues? That's something I can definitely discuss with Ms. Turner. I don't think she'd be averse to doing that, but I'll ask, we'll put it out there to her.
Okay, great. And all these questions have gone to Ms. Turner as well, so she's gonna be
And I
getting.
was gonna say, CPAC just sent out to our mailing list, and we're gonna post it, we made a form for
Okay.
parents and caregivers to submit concerns, that they're experiencing.
I'm not getting this
Nice.
type email, so I'll talk to you about it.
I haven't gotten one either.
So.
Thank
we
you.
can share that on the Friday.
Okay, that was just said that there was a survey that was sent out on that,
It's just a form.
a form,
Yeah.
okay,
That we'll collect and then we can share it, but
okay. You'll
we're trying
collect-
to sort of see the systematic issue.
Yes, okay, great.
Okay.
Systematic issues in a form that people can fill out via CPAC. Thank you, okay.
No problem.
Moving
So the
right
next
along.
question, will ESY be different? So Ms. Stafford oversees our ESY, or our extended school year program, for those who are not familiar. So again, this is also a legal mandate, and it addresses the issues of recoupment and regression, right? Or rather regression and recoupment. And so over the past several years, we've made a lot of improvements for the better with our ESY plan program. And we receive very positive feedback from our parents, and we're always looking for feedback because that's how we grow, right? That's how we improve. So nothing's changing with regards to ESY. It's a mandate. We will still have the extended school year program.
Yeah, no, it's gonna be the same. We're actually starting now with talking to case managers. The only thing that's changing is like information that we're disseminating to the teams. But just to mention about extended school year that I think often gets confused is that just because a child receives special education related services, it doesn't mean that they qualify for extended school year. And like something that we have to be careful of is like I hear this word a lot. It's like a pet peeve of almost mine when people say they can benefit. That's not what ESY is about, and we want to be careful that we're not placing children in the wrong program. Like a child can receive special education related services, but maybe they are like a regular summer school program or like an enrichment program is more appropriate versus extended school year, because it's not about learning anything new. It's really about maintaining skills.
Right.
But again, like Dr. Trim said, we're required to do extended school year by law. We're going to continue. So if you know what happened last year, we infused social skills into our extended school year program for everybody. That was a change that we made over the years. It used to be a separate social skills program, but code doesn't say that. It says special education and related services, not separately. So everyone and the people that are providing social skills are either social workers or school psychologists. So that continues to remain. We're focusing on the ELA and math. If a child gets related services, if it's recommended for ESY, that will continue. Sometimes children get related services during the school year, but it's not necessarily recommended for ESY because, again, it's about maintaining skills, and it also has to be a very critical need. And we also have our multisensory reading instruction. So anyway, we're continuing to do the same thing as we did last year, and that information will come out.
Right. And just know that ESY is not arbitrary. So you are also a part of this planning. So it's not something that just happens. So during your IEP meeting, it should definitely come up. The case manager should bring it up. Like, okay, like Tameka we're recommending Tameka for the extended school year program. These are the hours, or this is the program we're recommending, related services. Like, are you in agreement? Will you, with regards to attendance, you want them to attend, so you will know ahead of time if in fact your child will be recommended for the extended school year program.
And ask questions when you're in your meetings, right? So make sure you're very clear on what's being recommended. When I send out now I will tell you what will condense is I send multiple emails stalking parents to respond. I can't do that this year. So I'm going to be a little bit more strict with my timelines. That's going to change. But like ask. I've had parents say, I don't know about the ASD program or what program my child is in. Like, it's important to know that if your child is in the ASD program, the way we've been doing it here is that students, the program is a little bit extended longer for children in the autism program. So the hours are different, which you'll see if your child is recommended. So that's my point, to make sure you ask questions and they're clear.
And the last question on this topic, what is the status of implementing the 2021 audit? Will the budget crisis impede efforts? So I'm familiar with the audit, and just to be transparent, the results and recommendations in the audit, it can speak to any school district within the nation. Like the themes were pretty much the same. So we have implemented the audit. We've developed goals back from the beginning of 21-22 school year to present as it pertains to the audit. So we've been implementing the recommendations made. And no, the budget will not affect the audit. His comment, parents are concerned about the ignorant, anti-special ed comments community members have made repeatedly during this budget crisis. This community is feeling scapegoated. That was a comment. So question, what can the district do to educate the community that inclusive education is important for all kids? So I think this is a very important comment. Our department agrees with this comment. And then we'll get to the question. So I think for the most part, it's correct. The individuals who are making or have made these comments, it's ignorant, right? Because they don't know, right? And the comments range. So I will say this: CPAC, like our department works very, very well in CPAC. So members of CPAC developed some questions that we've answered via our department, Ms. Kay, thank you, Ms. Artman, that we've answered, and we have forwarded to the superintendent for review, and we will, send back, and the questions I know would be posted or what have you. In addition to that, I know that I received, was it yesterday, I think, an email or I believe it was yesterday or the day before. Miss Ivy, who's Miss Turner's secretary, came to me and said that she's meeting, I believe, with some individuals from the community that had made such statements, and so her and I will be a part of. We will be meeting together with some of these individuals to address that. But it's built out of it's built out of ignorance. Like they don't know, they're not aware, and like. There's a lot of things that I want to say that I won't say, but special education, it's not a drain on anyone's budget, right? It's not a drain on this budget period. Our students with IEPs have every right to be educated appropriately, the same as they're typically developing peers, period. And if that means that they require more services in order to do that, so the playing field could be leveled, then that's what's going to happen, and that's what they need, period. It kind of like I get kind of like very, I guess, passionate about it, because some of the comments are, our students who are out of district and and the tuition and budget. We have 76 students out of district this year. And when compared to the amount of students that have IEPs in district as well as overall, that's nothing. I'm happy to say that with regards to the amount of our students that we have out of district, is we're in the lower end. And that's outside of settlement agreements, right? And so the majority were not unilaterally placed. Those were decisions made by the district to send those students there, because unfortunately we can't provide the services that they need, right? Most of our students who are out of district are more like severely disabled population, our non-disabled students who may be on feeding tubes and breathing tubes, and like we have students who severe dyslexia, different behavioral problems. It goes on and on. So I'll also say this, and with regard to tuition, I'm sure you all have access to our student. We receive funding through XAID, Extraordinary Aid Services, right? And typically that comes out like from our ESY program. We also receive, and for the past several years, it's ranged from, I would say, like maybe 5 million to upwards to $7 million. Similarly, we receive IDA grants that we also put towards, and these go directly to for our out-of-district tuition, and for the most part basically covers our out-of-district tuition. And these are services that we bill for, right? Like, let's say extraordinary aid, meaning everything that goes over, like, so let's say, for example, in our extended school year program, our students require this program because of regression, and so it could be recouped. So come September, they're not further behind their peers because they had services during the summer. We then put in to the extraordinary aid grant. We then put in what services they received, and then we receive funding for that as a result. So the funding that we're receiving, it's funding that our students require, the services that they've had. So it's a lot, and I'm like I said, I could say a lot more about it more articulately, but it's not nice to hear, right? And like I said, I'm not a parent. I don't have children. I consider everyone in this room my children, but especially for parents of children with disabilities who receive these services, I can only imagine how much worse it is to hear some of these comments. So we'll be tackling that as well.
Can I ask a question? I know that you're going to be meeting, or Ms. Turner will be meeting with those individuals individually, but is there a way to have a discussion at the Board of Ed meetings and just announce to everybody the reality of what you just said?
100%. That's also in the making, yes.
Okay, that would be great. Okay, thank you.
You're very welcome.
I feel like I can't.
See, it's not so bad. Don't worry.
No, everybody's doing
okay.
Everyone's doing very well. Thank you so much.
We really appreciate that. Thank
Yes.
you very much.
Yes.
Yeah, absolutely.
And we appreciate you being here.
Yes.
Thank you.
Thank you.
Thank you.
Yeah.
So the next category, excuse me, classification issues. Oh, okay, yeah, this one. Parents are hearing children of color are being declassified because the state identified a disproportionate number of classified students of color. Parents believe kids are being wrongly declassified or unable to get evals. Question one, before we get, let me just go to question one, I'm sorry. Question one, is the district under corrective action or remediation plan from the state due to overclassification? So we were cited for not overclassification, overrepresentation in special education, right? And again, that's not a Montclair thing. It's not a New Jersey thing. It's a nationwide thing, right? And so what happens is the state, like, they'll audit and they get this information from what we submit, annually. And so we were cited for overrepresentation of our African American students with the intellectually disabled category. And we were also cited for our Hispanic population students under the category of CI, communication impaired, right? Yes. And so what happened is the state, they don't assign you anyone, but like they put you on a list to meet with different groups. So the group that we met with was through Rutgers University, Dr. Eddie Fergus and his team. Phenomenal people, phenomenal team. And various districts and we were mandated to go to, I think it was like 3 to 4 different trainings throughout the year at Rutgers University and it's not just us, but we bring our entire team. So that'll be DPS. We'll bring some representatives from maybe some teachers, building administrators, child study team members, while we go through how got on this list and what we can do to get off the list or to make sure that these things are being addressed. So in doing so, they gave us the formula, and it basically had to do with how many, compared to how many students were enrolled in a district, how many white students were classified under the same disability category as African American students. That's the intellectually disabled. So years ago, it was a mildly cognitively impaired category. And so that's how they arrived at this information. And then as a result, us being cited for it. So there's no like corrective action plan. They work with the district to do that. So what we did was we pulled out, we said, okay, well, how many students do we have under this category? And I believe it was like 14, right? So we then delved into each 14, we reviewed the criteria, and what we found that was happening was some students, like, so let's say if intellectually disabled, there are 3 different areas that are targeted, right? So it's cognitive ability, like, so which you get the information via the assessments, the psychological battery, psychological assessments, onset before 18. And you also have to have an adaptive scale. So years ago, there was like this study, I think it was called the, maybe it's offensive to use, like, let's say the intellectually disabled child after 3 p.m. or something, because while in school, the student reported were having all these difficulties, but at home, they can do any and everything. So that you have to look at adaptive skills as well, like what the student can do independently outside of just psychological batteries. So in reviewing the information, we found that, and this, it goes back years, it's not just like a pop-up thing. We found that in some cases, adaptive rating scales were not done. We found that in terms of the cognitive battery, so it's like, because everything is kind of subjective, some students were like on the cusp or what have you in this particular area. Like, so like case manager teams were not looking at I guess like the entire battery, yeah, I was the entire battery using like the different authors or experts. They would just, like, code was like a 1.5 standard deviation or below, or kind of like in layman terms, anything below 70, score of 70. And so some of our students, in some areas, they would score below 70s, but in other domains, they would score over 80. So that's not a student should be considered like intellectually disabled. So what it was, just a lot of training. Like, so we had to, like, retrain or retrain and train some individuals. And when we looked and we went through the retraining, whatever, now students were still eligible for services, right? So they weren't declassified, but in terms of the eligibility category, then changed because they didn't meet criteria for that specific category, right? And the same held true for communication impaired students. So we have in our district at one point, like we had, I think it was maybe 2 years ago, I think during a hurricane, I think Hurricane Maria, I think it was when we had some students from other countries or even from Commonwealth from Puerto Rico that came on board, and like English was not their native language, right? So when they were, they say they were assessed, let me go back, they were referred for special education related services because the concerns were communication skills, right? And not just language, but it could have been articulation. It could have been, and when I say language, meaning not being fluent in the English language, it was language concerns overall in both their native language and the English language. And so when our speech therapists like evaluated them, we found that, yeah, they met criteria under communication impaired. But took a deeper dive, and then, like, we looked at those numbers again, and it sometimes it held true that it is what it is. So what'll happen in that case is, or what happened, I believe, in that case was we still met, we didn't meet our target because the classifications were appropriate, and then our students, they were still classified. But right now we're no longer on state monitoring and for disproportionality, within that area, because we had to submit, like, we met throughout the years with, I think every 3 months or so with Rutgers, Dr. Ferguson, his department. And we had to submit offensive paperwork to the state, monitoring different things. And we're very happy to say that we're no longer disproportionate for either 2 categories when they reran the numbers. But again, none of those students were declassified. So they still received services because they were still eligible for services. It was just under a different category. if that makes sense.
Thank you.
You're welcome. The next question, oh, if so, how has the district's procedures changed? I think I explained that. Question 3, has the district considered that reduction of tiered interventions because of the budget crisis will result in higher special education needs? Yeah. If so, is anything being done to shore up those interventions, including in the face of reduced curriculum support teachers? Yeah. So this is a concern for everyone, for our department and EC&I, Equity Curriculum and Instruction Department, because over the past couple of years, we really did some really good work with regards to our tiered supports, like beefing up supports, the whole bit. And so this was definitely a blow to us. Like, we have to be honest, a huge blow. I met with the principal just yesterday because she had concerns about tier 3 students in her building and the lack of multisensory support that they would now receive, because the mandate is first and foremost our students with IEPs will receive those services. So we're trying to get creative and think of ways, like, what can we do to ensure that those students in need. And here's the thing, while our tier 3 students, they're not at the level where they may need to be referred to the child study team, or they may not even, in some tier 3 students, some of them may have been referred, evaluated, they did not meet criteria or eligibility criteria, but they still require remediation in terms of, and then let's say it may be in the area of like reading fluency, or one of those categories or those areas, getting the necessary support. So that's something that we are still trying to work out, and I'm not gonna lie, it's difficult. I don't know that we'll be bringing back any more curriculum support teachers. I know that we've had a great deal of our teachers trained, and so now what has been happening, I know there's been some like push-in services that's being done. We have teachers who are now, we have multisensory teachers who are now like back in the classroom, so to speak. So they're they're not just doing multi-sensory instruction via pull out or just push in. They're also teaching like ELA and math, but they've been trained. They're OG certified, they're Wilson certified, they went through the IMSC program. So those individuals as well. So they've also been providing those supports, like more so push in the classroom. But that is a blow to us, and that's something that we are still trying to figure out what it is that we can do to support our tier 2 and tier 3 students who previously received this level of instruction.
So this is my question, if I can just,
Yeah.
if that's okay. I mean, this is like frustrating me beyond end, and I actually read like a whole bunch of studies for districts that were trying to reduce special ed costs. And this was actually the factor that the districts were identifying as the game changer for reducing special ed costs.
Yeah.
So to me, it's like, you're just, by, whatever the expression is, like cutting your nose off to spite your face, and it's going to come back to haunt you guys. I think that's number one. And like from the families I've heard from personally, the number of families that like this was the support before they got classified, just to me just means you're getting even more burden, right? Like once you get these kids that could have been supported better, you're even worse off when you get them. That's really frustrating. And I guess thirdly, so my son is classified, he gets math support through in-class resource. But then for some reason there was a dad or grandfather in town who was coming in and supporting as well in math. And he reported to me, my son reported to me, that was the best interventions that he's had in like his entire time at Montclair, was this like dad or grandfather that was sitting with him.
Wow. Was it para?
No, it was like a volunteer.
Really?
Renaissance for anyone that's getting it. Anyway, and he's also been getting support through a program that a bunch of high school seniors started from the high school year, which has been miraculous. And so I just really want to encourage the district to look for other forms of support in the community before, this can be solved, because I just suspect that it won't be solved. Between like the honors kids in the high school and community, like, like academic credit for them, something. Because there is resource in our community that in my son's experience has been better, quite honestly, than the teachers he's been provided in the classroom.
So we definitely agree that it's something that we need to look at, and we are. And I mean, it's bigger than just our students then needing an IEP or what have you. Like, our students need to learn how to read. and we had the support, and we like the data showed, like we looked at the cadence, and it showed like they were making gains, and so again, it's high on our list. It's a big one, and it is something that I know both departments are working on.
Yeah, and I mean, and just don't know that like we really do care because of the work. I mean, like I've been a teacher from 1999 to January 2022 when I became an administrator. I'll let you do the math, and then Dr. Trim she's been an administrator for longer than me, but but not the director that long. So my point is that in that short amount of time that we've been administrators, we have been making gains, and we've been working closely with EC&I. Like as the instructional person for our department, I've had endless meetings with the EC&I department as well as curriculum support teachers before all of this happened. So just co-signing like how you feel, and just know that there'll be greater discussions, because it's also beyond us, and we care about. One of the things that we were working on was looking at all of our learners, right? Regardless of ability, and making sure that they receive the support that they need and deserve. But also our students who receive special education, looking at like if they had supplements on their IEP, because we want to be careful not to over support. And if those students don't need that support, we want to make sure that it's provided to someone, regardless whether they have an IEP or not, as well. So it's going to have to be an ongoing conversation, but we do care. And thank you. I do have questions for you later about what you shared, but I'll wait until the end.
Right. and so this is thank you. So just to say that it's going to take time, but we know that time is what we don't have. But just know it'll be something that's happening sooner than later. We've been engaging in ongoing discussions, so a plan will be forthcoming to see what it is that we can do, what supports we can offer for our tier 2, tier 3 students, much sooner than later. Like I said, I just had a meeting yesterday with the principal who's very concerned, like how she was supposed to support her tier 3 students in this particular area, because there are other ways to support. Not every student who's tier 2 or 3 require multisensory instruction, but speaking specifically for this population. So something that we've been working on.
Thank you.
Next question. What would you recommend these parents do if they're concerned about being denied services because of this district's concern about overclassification? So yeah, no, like students are not being denied services. Just know that. I'm gonna be very honest. Like if something is happening there, I would say that it is, but they're not. If you feel though that you've where your child was evaluated and made, let's say the data shows that they should have received the services but they haven't, or what have you, we urge you like definitely follow up with the case manager, follow up with the building principal, follow up with the supervisor, and then myself, right? Like you have in every meeting you're supposed to be offered or provided parental rights and special education. We urge you to become very, very familiar with it. It's like dry reading, and sometimes not always like in layman's terms, but if you have questions about something like in the parental rights document, reach out. We can definitely explain it to you. There are different advocacy agencies, CPAC, like, go through it with you, etc. Just to let us know. And if you do feel like, for some reason, like my child is being denied services when in fact they do qualify, like there are different things you do, and price outlines it, file for mediation, due process, things such as that nature. And that is your right as a parent, like to advocate for your child or children. So don't discount that either. But like the first thing, communicate with the case manager. Like absolutely, like they're open, they're knowledgeable, they've had training in this throughout this. That's why they have the cert. Communicate with them via email, phone calls, etc., and then follow up with the principal and the supervisors. And again,
yeah. So, and I just want to say that each building in the district is a supervisor from a department is attached to each building. Yeah. So, for example, like you have Maria Meal, who's at the high school, and then you have Karen Tomini, who's over the elementary schools, and then you have me, who's now Siobhan was doing Buzz, but it's going to be me, and then Glenfield, and she has Renaissance. But like, I'm really the person that you could reach out for middle schools, and then we collaborate together. So you have my point is you have an administrator that you can contact first with your concerns before really taking it to the director.
That's fine. Many people email me, but let me say this: like, just know, like, if you have emailed and you have not received a response, you will get one. Sometimes it just may not be as timely as it should be, because we receive like hundreds of emails per day. And I know our district policy that responding between 24 to 48 hours. I'm gonna put that out there. So like the end of our workday never ends, let's just be honest. But like typically, like after if you send an email like after 4 or after 5, just know that the next day will count as the first day in receiving that email. And then we have like 48 hours, like, to provide a response. I'm not gonna like sometimes it takes me like 4 or 5 days. Like, I mean, I'll touch base, so I'm in receipt, I'll get back to you because we want to provide accurate and thoughtful responses. But if you didn't receive response, just send another email. Like on that same chain, just listen, hey, friendly reminder, I'm following up. Like it's not that we're being avoidant or we're dismissing your response. Not at all. It's we have not legitimately gotten to it. And sometimes it's in our junk. Like, so what happens is like, because all these like different hacks and things that have been happening like through servers and things like that. So the district has taken different measures to make sure like our servers and our emails internet it's safe. So it's been times when I've received email, like parents are emailing and I'm like, what are you talking about? I've never received anything. And I'm like, and I go through them and it's sitting in my junk folder. So then and I would respond and I apologize and listen, this is in my junk folder. And we follow up with tech and then they've since cleared it out or whatever. So sometimes that may happen as well. But please just send another email. Like don't call, like, don't stop.
I'll say you're amazing. You
Thank you.
respond immediately.
Thank you. I try.
Yeah. Very communicative. Yeah.
Thank
absolutely.
you. Appreciate that. Okay, the next category, reading and writing supports. Many parents are concerned about inconsistent and limited availability of O.G. Wilson supports. For some schools, it's not available at all, and certified teachers are few and far between. Parents feel this creates a major equity issue and also results in predetermined services. Question, is the district working to create more consistent services at all schools and with more certified teachers? Yeah, so this kind of goes in hand with the previous question with regards to our losing our multisensory instructors. So I'll say this, before the budget situation, we had more. I can think of one school right now that had like a significant amount more of multisensory instructors, and that's because we can't met. So while the district we developed a program through Fairleigh Dickinson to have our teachers OG trained, it's not a service, something that we can mandate, right? It was completely voluntary. So if we have X amount of teachers from a certain school who volunteer to, yes, I want to participate in this 2-year program, this 2-year commitment, and then we have no teachers from another school, then unfortunately that's how we end up with a lack of or little to no teachers at that one particular school. So now this time around, budget wise, I know that our HR director and like all of our departments, what we did, we tried to at least make sure that each school had at least one multisensory instructor, like when individuals were being transferred or what have you. Do they need more than one? Yes. But we are working on this because it's a huge topic. Yes.
Like if we get all this funding from state and other programs and we're not being affected by this budget problem, who manages our money, like for special ed? I mean, it should hopefully the same person that's managing the other is doing it. Because it seems like there's a lot of money that if someone's managing it correctly, we shouldn't get short. And in fact, we should get more. So we don't have to send people out of district. Like, can't we adjust it?
I think I understand what you're saying. So with regards to funding, it's not like we get like a ton of money. Like not at all. Like we receive funding. And for the most part, the majority of our funding covers like what we need as a department, not just to send students outside of district, but different, let's say, to pay like for vendors, like when we do have individuals on leave or leave replacements, like just so many different areas that we also have to put funding in for. And so while in the past, like our department, Pupil Services, we paid for I think like through a grant too for the most part, and then we subsidized the rest. Is when Tom Santagato was our director, and he I'm telling you, he did a great job in reaching out to Fairleigh Dickinson for this program, like for the OG developing it, the whole bit. But outside of that, like it's so yeah, he did that, and it benefits, of course, all of our students. But this is not like a I don't want to say just a special ed thing. Because it benefits all of our students. So it's not just a program like where we use special ed funding for it. So it's funding from each department. Like sometimes like we may, split funding, or it falls under EC&I. So they have to then fund certain things. And there's different grants and just put different parameters in the grants. Like this can only be used for tuition, or for direct instruction. So yeah, it's not as clear cut. Sorry. Question 4, a lack of coordination between gen ed and pupil services training issues. Parents are frustrated by the lack of coordination between special ed leadership staff and gen ed side leadership staff, such as principals, ECI, and pupil services. Question, do you have a vision for how these three groups can work together better? So I will say that we have been, I know we meet weekly, every Tuesday in our senior staff meeting. Our department, EC&I, for minimally like 4 hours. And our departments, we do work closely together. This may not have always been the case, but I know that we're doing so now. Like even with regards to the inclusion program, like Ms. Stafford was very key facilitated with regards to the grant writing, and that's when our departments, EC&I, building principals, child study team, work hand in hand with regards to that. So, I mean,
I'll say this, like we've made progress, right, with meeting with the ECNI department. When it comes to training, we don't disagree that more training is needed for our gen ed staff. And I think something that I don't know if the parents, really realize that in education we have barriers, right, that are out of our control that we have to work on. So I'll give you an example of what I mean. We have like select professional development days when we're allowed to train staff, and then outside of those days, to be able to train, that requires pulling the teachers away from the students, which is it's a barrier, and especially now that we have this budget crisis. But I know I have been a big advocate for discussing like that we need training outside of content specific. So when like IXL was developed, or with oh my gosh, our ELA program, thank you, with CKLA, then now we math, then that became a priority for training teachers, right? Be focusing on content specific, so they do have to do this new program. So it is a discussion. It's something that we have to work through. We're also looking outside of just content specific, but focusing on other things to train, meaning like it could be about behavior, it could be about inclusive education. I'm a huge advocate for that. It could be about differentiation, and list goes on. So we have been discussing it, just so you know,
Yeah.
And trying to brainstorm ways to do this. We've even collaborated with MFEE and have some ideas, but with the budget, everything kind of like paused for a minute until like people are moving to see what happens. So progress needs to be made. More training for gen ed teachers, absolutely. We have been training principals, but more time is needed, and we need to do more. So
Yeah.
Agreed there.
Yeah, just know that it's fluid, right? Like, so it's ongoing. And to Ms. Stafford's point, like it's not like, oh, well, we've come this far, we've done this in terms of training, and that's it. It's ongoing. It's ongoing.
Can I raise a point that's related?
Sure.
It's not about the budget, but on the topic of coordination.
Mhm.
So my child is in a inclusion classroom with a special ed cert co-teacher and a gen ed cert.
Yes.
And there was nothing communicated to gen ed parents about this system. So a lot of the gen ed parents seem to have this idea that the special ed cert teacher is not there for their kid, which leads to kind of a lack of regard or respect for that teacher, even though they might be implementing techniques that are benefiting their kid.
Right.
So how do we frame it for the general population so that the gen ed parents understand that these two teachers are addressing the entire classroom?
Absolutely.
And it's not just that one is siloed.
It's a mindset shift, right? And then it's just a lack of understanding what the role of the special education teacher is, a lack of understanding about inclusive education, a lack of understanding about what students are, what's afforded to students, or what they're allowed to have and what they actually deserve. So I think there needs to be education, because, you know, a lot don't know. And I think it's just a matter of us like working with Mrs. Turner, and finding a way to have like these meetings where we can discuss what is it like, especially for elementary, right? It looks differently for middle school, but what does it mean when you have two teachers in the classroom? And, you know, what does it mean when a child has this IEP mandate that requires in-class research as to why you have a special education teacher in the classroom, and how having neurodiverse students in, you know, in the how that benefits everyone. It's a lot of education. And I can be honest and tell you, when I was teaching, like as an administrator, I know more now than I did with teaching, just based on opportunity. So like I didn't know about New Jersey, like NJCIE, which is like New Jersey Coalition of Inclusive Education, which is now All In. So I learned that as I went along, and our department wrote this amazing grant that was afforded to, which is like the New Jersey Inclusion Project. So I say that to say we just need to like have work on mindset shifts, and it's like beyond parents. It's community, it's other teachers that we need to work on. And some people, no matter what you say, when it's not their child and they don't have an understanding about special education, they don't care. You know, it's very focused about my child, and is something going to be removed from my child, and is this going to be detrimental to my child? And what people don't realize is that all children learn differently, right? Like everyone, it's not this one size fits all approach that we have to stop like working. Everyone learns differently, regardless if they receive special education or not, which is really like specialized instruction. But I can go on a whole tangent, and I know we don't have time.
So
We have just, oh, sorry.
Oh, go ahead.
Somebody has a question.
give me 1 second. I just want to say,
Okay.
so while we do have parents like that, because you know they're unaware for the most part, we do have on the flip side of that, parents who are like, yay, like this is great, like my child now can receive the support and the benefits of having two teachers, one who's able to modify, and they benefit from that as well. But to your point, yes, more has to be done to get this information out to our to parents of our general education students, and we'll work on that.
Sorry, the person online, do you want to ask your question?
Oh, sure. Thank you. So to that vein, you know, as you know, our district has like an opportunity achievement gap issue. But some of that also can extend not just to, you know, racial groups, but also students, you know, in the special education population. You know, there are students with IEPs who do, you know, strive to take honors and AP level courses. And so depending on the class, there's varying levels of support, varying levels of understanding and education on the part of, say, like a general education teacher on, you know, the needs, you know, of those students. And so what I have found personally, and what I've heard is that, you know, often there might be an opportunity to kind of like dis disincentivize students from taking those more challenging courses, because it might mean more work on the part of a general education teacher to make sure that those students would be, you know, accommodated in some way. Are you tracking like how many students, you know, that have IEPs are taking honors and you know, AP level courses, to kind of like see if there's like we track the numbers of racial demographics, you know, if they're underrepresented, and if so, are you finding that there's not as many? And, you know, what is there an effort to kind of find out why that is, and, you know, what is behind that? What can you do to increase those numbers? Because again, just because you have an IEP does not mean that you wouldn't be successful in those classes, but that you might need some sort of accommodations. And I find that I have a senior who's on their way to college. I find, and I've, you know, taught at the collegiate level, I find that colleges are more accommodating sometimes of students with disabilities, you know, in challenging classes than maybe at the high school level, you know, depending on the class. I find math in this district, you know, is particularly challenging for students with IEPs at the honors and AP level.
Okay. Thank you. Good, very good. Thank you for your comments, and very, very good question. And to answer, yes, we have been tracking it. I know that it's so funny. Yes. So yesterday I keep saying talking about yesterday because yesterday we had our administrative council, and we meet once a month after school, and this was something that came up with regards to appropriate supports for our students in honors classes, AP level class. So I do know that our supervisor at the high school, Maria Mayo, as well as the APs, the principal, and our director of guidance, they do have this information. It's in the Genesis system when we look at our student schedules in terms of the supports that they've been receiving. So I do know that we have the data. And we did start, as a matter of fact, in December, the end of November, early December. I know that we held our first meeting. I was not in attendance at that meeting, but I do know that a meeting was held specifically to address this concern.
Thank you.
Yeah, and it's something that will be ongoing.
Great.
Yep.
All right, let's keep going. We have a half an hour left, so we want to make
have
sure to get all the questions in. Certainly. Oh, yes.
Thank you guys so much, by the way. This is just, I hope you come back. There's
Oh,
just
thank
so
you.
much
Yeah.
amazing and
Thank
so
you.
Oh,
generous.
thank you, guys.
Thank you.
We're all in it together.
Yeah.
We are.
So
We
I
are.
don't know if this has been addressed yet, but my son's graduated, by the way.
Yes.
Full time at Montclair State University.
Yes.
Nice.
And we actually had a very good experience, and he did get supports. We had some challenges, but we worked with the child
Yep.
study team, and it was very individualized. So
remember,
thank
yeah.
you for that. My question is more from the social perspective.
Yes.
And kids with IEPs or that are, kind of self-contained and
Mhm.
sometimes they're, we had a very, very challenging situation with our son socially.
Okay.
He really wasn't included. Lunch times were brutal
Yeah.
for him.
Yeah.
Even the pep rallies, anything they did afterwards. And I know that there were some efforts for like a lunch bunch and this and that. It wasn't consistent.
Yeah.
And when I think about him having lunch by himself or in the hallway or being bullied, and there was honestly, and I know like you guys are up to your necks, but that thing matters so much as the academics.
More than the academics.
That they feel that they are part of this also, and it's really nuanced,
Yeah.
but it's critical.
Yeah.
So
And-
is there anything being done there?
Yeah, I agree with you, and it gets difficult as they advance in grade, like elementary, to you see it, and it does. I know that if I can speak at the high school, like we've had like the inclusion club and
Mhm.
but different thing, and I know that we had a case manager since retired that did
Dr. Singh.
different social, but like you said, like it has not been consistent. That's something that we need to work on, and I'll definitely put that on the list. Yeah.
It's a question on it.
Yeah.
That's about it. It's 1 in 6.
Yeah.
1 in 6 kids. We're not going away. We're growing.
Yep.
We're gonna expand. But I think, understanding is such a big part of this. And I think the gen ed population need to be taught that we're not going away. And there's a lot of us.
Yeah.
And to make a little effort, be kind. My son has been bullied every year. He sits alone every day at school. He's a senior. It breaks my heart. And I know you know me. But, we need to educate other children so they can go out and be more compassionate.
Yeah, this needs to be an
towards kids.
integral part of the
Right.
curriculum, starting very early.
Yeah.
I just want to say,
Let's put it together.
Let's do it.
Miss Williams at Watchung is launching, which is amazing, a recess club. For kids during recess,
Yeah.
which would be amazing for my kid, probably all your children as well, recess clubs. That would be amazing if they can continue that in other schools.
Yeah.
Lunch too.
For lunch, recess, but a club where your kid isn't lost
Yeah.
on the playground and alone.
Yeah.
So hoping Buzz does something like
Yeah,
that.
I think that's great.
Yeah.
And I'll something, like I said, like we're gonna
Yeah.
compile all of this stuff and
Yeah.
make sure we address it, try to, I my concern, I think, Ms. Connections, too, it's like when they move on from elementary school to middle school and high school, like we start to see like, like the divide, like, you know what I mean? And
Yes.
therein lies the difficulty, like,
Yeah.
what can we do, like, to ensure that that doesn't happen? It has been an issue. It has been an issue.
And we agree. And I'm a firm believer of also like starting young. Like if I had my way, I would love to have like some type of I don't know, this is not the name, but like a disabilities awareness, or just a class that focuses on understanding the differences of students. And it's not just, it's so much bigger than us in this room and anybody who's going to see this recording, because it also goes back to like parenting, right? And what's being discussed in the home, and respecting everyone for their differences. You know, bullying is an issue, and children can flat out be cruel, right? And because it's all of us. That's why it's just like, this is great, because it's not about pupil services against the parents. Like, we really need to be a community working together, and we also need our families who don't have students who receive special education to understand. So it's been an ongoing thing. And then we talk about barriers, right? So when you come to after school programs, you have to have somebody who is willing to do it, and then you have to be able to, what's the next part?
Pay for it.
You have to be able to pay for it in addition. So we need to just work with our teachers and have a larger conversation, and pulling in, even like there's some like beautiful students who want to work with students who may have some difficulty socially, and using those students to kind of like, hey, can you help along, you know, and talk to, like, just working together.
They have,
right?
you know, there's a gay straight alliance, if that's still allowed in schools, I'm assuming it is.
Yeah.
Why, you know, we've talked about this for years, having a disability, you know, alliance, so that people are, I mean, why, once again, disability is the uninvited guest to the social justice table. These are really critical issues that impact a child's ability to learn if they're stressed or feeling excluded. And in addition to that, it's this is, I would say, I don't know if this is accurate or not, but I would say that the vast majority of children who, or some of the children who go out of district, it's because of the social issues that occur as they age, as they get older. And if that were addressed earlier, that really might allow for people to get a handle on, you know, the academics and all of the other things. So that's just my 2 cents.
Yeah, I think it is a major issue. It is a huge issue. And
the money, meaning
how we
the
can
money should be
tackle it.
allotted for that. That is something that is a priority that,
Yeah.
Volunteers to facilitate those things. You just gotta put it out to us.
Yeah.
Right, but I think just the key is consistency.
Yes.
Right, because like I know at the high school, like I said,
graduate.
right, like we have and that's what exactly. Someone graduates or retires or resigns, and it's like, oh, there goes the program. So I think we just have to work on being more intentional about it
And having it be part of the, you know, an
Yeah.
institutionalized.
Yeah,
In general, like kids to know.
absolutely,
Stay
absolutely.
tuned. We have a question that, and also to say that we have a new director of school counseling, so it also brings her involved, right? Who's also class of 1994 grad, who's committed to serving the student.
Yeah.
I wanted to add, so at the high school, they currently have the Best Buddies Club. It's run by Mr. Acosta.
Oh yes,
And
yes, yes,
they
yes,
came
yes.
into the self-contained class, told the kids about it. My kid got like super pumped about going to this thing, and he goes now. I think it's like on Thursdays.
Nice.
Every other week, but they had like a holiday party. Someone wrote him a holiday card. As a parent, it feels a little pandering. Like, I don't know how, like, he's treated differently. Where like someone mentioned, like, people should just be taught, like, my kids to go at lunch too. And he doesn't get bullied. He's sometimes a bully. That's a whole other conversation about behavior.
Yes,
And
yes.
supports for behavior. But I just wanted to let other high school parents know that exists. That's the current iteration of the inclusion club. But yes, it does change, you know, with the staff, but it does currently exist. And he,
Good.
for whatever our hesitations were, he loves it. He was so excited about this holiday card that one of the kids wrote for him. And so it's nuts, and it's
It can happen.
Yeah.
I kind of thought
Thank
just in
you.
terms of engaging peers, like
Yeah.
some of our neurotypical siblings are a great source of support for, you know, their not neurotypical siblings, right?
Yeah.
So like, I feel like that population of kids can be a resource at the high school and middle school, because they understand what these kids are feeling, what they live with it. And they have sensitivity and experience. I also have heard from some of the older high school students that they're worried about clubs, neurotypical more than anything else, worried about clubs being canceled with the budget. This could be a really cool way of, you know, giving college bound kids the opportunity to talk about the great work that they've done with a vulnerable community. So it could be good synergy.
Which happens, but then they graduate, so that needs to be a part of,
Yeah.
you know,
Yeah.
the
Yeah.
institution.
But
Okay, I just want to
peer support is.
Yeah.
peer support. Yeah, let's keep moving, because I just want to respect the people who did send in questions.
Sure.
Okay.
thing.
We are.
Further to
I guess we can go to communication and staffing changes.
Okay. Many parents find out that case managers left, their file was transferred and they are not informed. How can the district improve on this? So we do, like, directly just this week alone, when so when we know that our case managers are leaving, like we may receive resignation notice or retirement notice, and then they typically have to give 60 days. When we have what we try to do, like transition wise, is have a letter sent out by the outgoing case manager, and then introducing the new case manager that's coming in. Again, that has not always been consistent, because right now that's also happened. Just this week, we have a new case manager, and we sent out information prior to January 5th, the return date, saying, okay, like, you guys work together to send the notices out, etc. And that didn't happen for whatever reason. So yes, that is definitely a concern. There are times when it hasn't been consistent. Let me put it that way. So we do need to streamline that. So even if it means maybe just getting like a one communication, maybe from the building principal or our department, that's something that we do have to work on. I do know that as a result of the budget cuts, like, I know that building principals did send like notices out to parents, informing them, and I think they call like individuals out by name. Like, it would be like Siobhan Trim will no longer be with us, but we now welcome Tameka Stafford into this new role. But like on just the regular, like, individuals leaving or resigning, we do have to come up with a better like a department wise, like a better way to inform parents. We're gonna work on that.
Thank you.
Yes. If a parent has a reeval or annual meeting coming up and there is no case manager, what should they do? So there should always be a case manager, because the case manager is responsible for completing the IEP. What may have happened is they may not be, because I know we have a case manager on leave right now. And so let me take that back. I'm trying to figure out how I can say this without discussing the personnel part of it. So we have a case manager that's not, the person's not on leave, so we can't hire a leave replacement. Let's just put it that way, right? So what happens in that regard is that the other members of the team will then take on that case, or the case manager's caseload. And so that individual will now be responsible for developing the IEP. So it may not be the case manager that was there, but there is a case manager, because the case manager is the individual that develops the IEP. So if you're there for an annual review or reevaluation for the IEP, that person who's facilitating is serving as the case manager.
Maybe my question.
Okay.
Sure. So yeah. And again, it goes back
to
the
Buzz?
first question. No, so that I have two daughters.
Okay, sorry.
So this pertains to my other daughter that's at Hillside.
Okay, yeah, that's what I would think.
So yeah, and it goes back to your first question.
Yeah.
There was no communication.
Okay.
Whatsoever. And just a verbal communication with the principal, he kind of indicated, well, this would be who your point person is.
Right.
But again, nothing sort of in writing. They never proactively reached out to me.
Right.
Our IEP annual meeting is coming up.
Right.
So, I know everyone's constrained to, so
Yeah.
I'm like,
What's happening?
And say what's going on, like what's happening here. So
So in a situation like that, right, it's difficult to send out communication because things aren't really like clear cut. It's not like individual resigned or retired, is on a leave. Like, there's,
I worked in HR. I know the sense.
Yeah. Sorry, I can't kind of.
Yeah.
So it's difficult, like, in terms of, but yes, I thought something here yes, we can send, even if, it's difficult to send something out because you don't want to be vague, but you're kind of limited as to what you can say. Like, there's nothing untoward going. Let me just say that, like, because since we already said like what school, nothing like that at all. And then with that situation, we don't know for how long, right? It's kind of like every day as it comes. So but yes, long story short, let me just, we will definitely be working on that, make sure we send something out.
And I imagine a lot of these are related to the unions that you have to be able to work with the conditions that, what people's rights are
Right.
via the union. So it makes it
It's a
challenging.
little bit difficult, but the individual who submitted this, I don't know if it was your question, whoever submitted this question, it's true, we can definitely do a better job of communicating with regards to that, and we're working on
And
it.
should I just reach out to the person who I was kind of told?
Yes,
might be the one
like
to
whoever sent, so,
come in?
yeah, whoever sent you the letter, so when you received the invitation letter,
No, I never received it.
when is the meeting?
Well, no, her meeting should occur by March 2nd.
Okay, so you haven't received it yet, but
Yeah.
you will. But you can email or contact either two members of that child studies team, the supervisor, even myself, the principal. But what'll happen is, as it gets closer to the time of the meeting, you will receive an invitation letter, and that person, the invitation letter comes from the case manager.
Facilitating it,
Yes. Yeah.
All right, thanks. Let's keep going, please.
Okay.
Study skills, I could take.
That's study skills. Okay, go ahead.
So this study skills is the next one. It says many ADHD parents feel that there is little training for study skills staff and dramatically inconsistent services offered school to school. And then the question is the district looking at this issue? Will anything be done? So I'll just say that for study skills, our department created like a curriculum guide for all of the study skills teachers to use in each building. I'll tell you where there needs to be improvement, and also that a little more information I think will be needed just for our understanding, because sometimes we don't know, right? So like when it said that there's inconsistent services offered school to school, I think I would want to just know a little more information about what does that mean and what schools are we talking about.
Well, like Ren is 2 days a week and Glenfield is 5 days a week.
Okay.
That's just an example.
Oh, okay, got it. So, and that's like another because the buildings are also, they're middle schools, but then like their schedules are different, right?
So the periods like at Buzz are longer, or 80 minutes.
Right, and then it's like every other day. So I think it's a bigger issue because you're talking about scheduling, right? You're talking about minutes per building. You know, and that is where it's a scheduling thing. And it's not, when it comes to like scheduling and doing a master schedule for a building, it's not something that you can just like fix in the middle of the school year without disrupting everyone's schedule. So it's a conversation that has to be had like now in preparation for next year to kind of get an understanding of what happened or why the minutes are a little bit different. But for each building, it might look based on their classes a little bit differently. But I think there just needs to be a deeper dive.
I agree. I mean, I think this is a huge issue for the ADHD group, but I'll just say like print out what each school is getting and you can probably see the differences.
Yeah, like we'll look into it. Because there's going to be more conversations that are had, but if there's more information, then we need to know about. So anyway, to answer the question, as the district looking at this issue, the district is going to look at this issue, and will anything be done? If there's a huge discrepancy that's impacting our children, then yes, something has to be done. But we just need to find out more information about it.
I
Yeah.
think that skill situation,
Nope.
it's very dependent on the teacher that's assigned to that class.
Okay.
Because they all have a different approach to that class. That's
Okay.
middle school and at the high school.
Okay.
Some of them are amazing.
Mhm.
Other ones, it's like free time.
Yeah.
Right. And it's right. And I can be honest and say that like when creating the study skills curriculum guide, that was something that we wanted to work away from. And that is to not give parents a false narrative of what study skills is, and that it's not a homework center. And so if it's needed, if a child needs homework, then they need to be in solely homework. And when I say homework, like I just need to get my homework done. That's what study skills is not about. So we really have to be honest about what that class is supposed to be for and what a child really needs, because I'll tell you that I push back on teachers about changing the narrative of study skills, and also and what needs to be done, because this is what I'll just tell you this so we can move on. Some students would come in and would say, oh, I don't have to do this at home, or I don't need to get this done because I'm going to get it done with my study skills teacher. We don't want to over support, and we want them to be as independent as possible. And when we provide that crutch, it's not helping them. And sometimes like if students graduate and this is like, oh, I've always been dependent on someone, we want them to be independent, and we want them to be contributors to society as much as possible. So it's we need parents on board too with discussing study skills. And then I agree. And now, thank you for sharing that it's varies depending on the teacher, which means that there's classroom observations that have to be done.
Yeah.
Also varies about what each individual student needs.
That too.
For that week or month. If they need extra help from a math teacher, I know some of the teachers at the high school were like, oh, I know who's on break.
Right.
Let's see if they can come down and talk you
Mhm.
through whatever the
Right.
skill is that you need to have some
Right.
reinforcement. So again, it's like, it's a not one size fits all, but I
Mhm.
think the focus of study skills should be
Agreed.
Can you say
Agreed.
what you want the narrative to be, not what you don't want it to be? Because my
So-
son did study skills and I thought it was study hall. So if you could tell
Oh.
me what it's to be,
So that,
I'd love
yeah,
that.
so studies.
Okay, yes. So study skills would be like looking at like executive functioning skills, right? And then, so for example, let's say I'll just make up something, like not make up, but it could be note taking, it could be organization. I mean, there's a whole list of skills.
And that's
So,
within the curriculum.
yes. So there's different skills in the curriculum guide.
Would you love to see that curriculum?
It was given to the teachers. Without full transparency, a parent one was created that needed, but it wasn't sent out because it needed to be revisited and revised. And life, I'll speak for myself. Life stepped in, right? And like, I have a sick father who just passed away, so thank you. So it's just something that has to be circled back to. But it was given to the teachers just to use as a guide, because again, one size doesn't fit all. And so it's used. You can use the content when teaching the skills. For example, let's say a child has a science test, right? You can reinforce a skill while addressing the need of studying for that science test. So it shouldn't just be focusing on get your homework done, because then what are we teaching them?
Right, it's like both and.
Yeah.
Yeah.
Okay.
Say again.
Yeah, time management.
Time management, yeah, all of that, because we want them to be able to do this on their own. And like, truth be, some children don't want to do homework, right? They just don't want to do it, no matter what you say. That's not their thing. Academics is not for everybody, and that's others. That's all the, like, it's another issue that that one is a little bit tough when children just don't want to do it. And then the question is, as they get older, how much can you force? And then when do we start talking about consequences for not doing and what that looks like? Because we want them to be independent, right? And to be able to function on their own without us. So it shouldn't just be a study hall, but it depends on what is in their child's IEP and what do they need. But we should be reinforcing skills. And on top of that, they don't have to stay in that forever. You know what I mean? Like, it shouldn't be where they're in it. It depends on the child. Let me just say that. But they don't have to be in study skills 6th grade, 7th grade, 8th grade. It doesn't have to, the high school, it doesn't have to be that. So if we're working on teaching students skills at a younger age, then it will condense, in my opinion, the study skills need later. That's just me. Email me. Yeah.
Thank you so much.
Yeah,
All
that's part. Okay,
Okay,
that's part
sorry.
of the reason. That's part of the reason why. I'm sorry. That's part of the reason why we created the study skills curriculum guide, and we have one for parents as well. So we're still it's like 99.9% done. We just got some feedback that we just need to like incorporate in it, and then we will be sending it out.
Thank you.
Okay.
All right. Where are we?
Miss Services. Question: how does the district track? Oh, this is a good one. How does the district track missed services like PT, OT, and speech to ensure the IEP is being followed and compensatory services are provided if needed? How can a parent obtain this information? It's a good question. So what happens is if a student, if a student has missed any of these related services, right? Our service providers, they have to keep notes by law and maintain attendance. And so what you'll see is, let's say if we have providers that are on a leave or absent for a significant period of time, then we track the absence, and we have a spreadsheet. On the spreadsheet, we had the date the service was missing, the date and time service was missing, the minutes, and it has to be provided. And this is only for like a prolonged period of time, because what happens is the model that we use, if the therapist or the provider is absent, like we use a 3-to-1, when they come back, like in another, I think this 3rd week, when they're on for week 3, then they'll provide services for what services were missed during the time of their absence. We did have this situation, maybe 2-3 years ago, where we had a speech therapist that like had like an emergency, like she had to go out like that day in an ambulance, and she was supposed to come, and then she did not come back for the remainder of the year. In that situation, we didn't have time to post, like, because she was not supposed to leave, I think, like until like December, and she went out like in October. So, and then finding someone was difficult. So by the time we got someone on board, it was like December, January, and our students and missed like a significant amount of time, a significant amount of speech. And it was difficult. So what happened was, and we had to develop a spreadsheet. We put we went to HR. We had in-district speech therapists who were able to provide before and after before school and after school speech services if the parents were in agreement. We did have, because it was such a significant amount of services that were owed. Some parents agreed to that even during the school day, but scheduling during the school day became difficult because now we're providing services that the student should have. And now you have to provide additional services. So even sometimes scheduling like related services is difficult, like you're missing there. So that's been like, that's a difficulty. But yes, by law, we have to provide compensatory services. And we do that. We have the tracking, the spreadsheet, because we're accountable and responsible for the state. And so what happens is periodically, like when we have this information, like right now for the Bullock case, we submit to the state like every 3 months. Yeah. Like every 3 months, we submit to the state. These are the hours that we've completed. This is what we have left, and our therapists have to sign off that they provided the services. So yeah.
Sorry, that was one question. What about if it's not an extended period of time?
It still has to be made up. If we have any providers that were unable to provide services because they were absent, there was some type of schedule conflict, by law, they have to make up that service. And they do it on the rotation that we use. Typically, they do that during that rotation period of time. Yeah. If that's not happening, please let us know. Yes, hi.
So our son that buzz, due to the cuts, is the greenhouse class was eliminated. So now, for 2 days a week, or I think it's A and D days, he has art for 2 classes.
Okay.
How do we get to that conclusion? And are there other students who end up in a similar situation, or is art being used in this case? Like, how do we get here?
Yeah.
I don't know.
I don't know.
I don't know the first I'm hearing
My
this.
understanding is the principal and vice principal at Buzz went through and they looked at all the students who were losing their teacher, their elective teachers, and then they worked over the holidays to reassign based on availability of spots and different electives and things like that.
And I do know without trying to revamp the student schedule, like release the minimal distraction, like so that way they don't have to redo the entire schedule, what have you. But I don't know, but I can find out. We can find out from the principal.
And then when the marking period's over, would there be another, could he
another like option?
Yeah.
Okay.
Because some of the electives, and he's nonverbal, and so some of the electives haven't been necessarily the best as far as adaptations to the classes. So let's see a little more of that and sort of help him out a little bit more. So it's productive and not just he's just sitting there.
Did you reach out to the case manager and the principal?
We just had a change now, so we just heard
a change in case manager.
Yes.
Oh, okay.
Yeah.
We had
Alex.
Oh yeah.
So we just got an email from her the other day, and we'll be following up with her as well.
Very good.
But just I wasn't sure if there was like a bigger picture there that was affecting other kids as well.
This is the first time I know personally. It's the first time I think we're both hearing it from you. And like I said, we're transitioning, so I'll be taking over for Buzz. So thank
you for But even when I was with Buzz, I didn't hear it. That wouldn't be something necessarily that would come to our department. But we could, we'll try to be of assistance to you. But now that the case manager, she's been in communication, she should be able to assist with that, get back to with what's supposed to happen in the next marking period, and try to find something, that your child enjoys.
Yeah.
When we leave, can you just give me your child's name so I can just take a look into it? Okay, thank you.
Thanks.
So I just want to acknowledge it's 11:35. I don't know how many.
This is the last. There's like 2 last.
Okay,
Take the last one off. I think we've answered it.
The last one,
The last one.
the 9.
Yeah, to go.
Okay, so then okay, there's an 8, but I think we can answer this one really quickly.
Okay.
Great. Okay, so 8, I can
You
do
got that
8.
one?
So 8 is a DCP&P question. Staff have a practice of inappropriately calling DCP&P on parents of disabled kids. This results in DCP&P who are not trained to recognize special needs becoming a permanent or semi-permanent presence in families' lives. Question: what can the district do to address this? What does that mean? What is DC? Oh, like
Department of
DIFAS,
Children
Department of
and
Children
Protective
Protective Services. Yeah, it was DIFAS before. Yeah.
Yeah, and many, just FYI, numerous people in our community have Child Protective Services called to them from the school staff not understanding
Yeah. So
disability.
yeah. So what I can say about this is as district employees, we're all mandated reporters, right? So, and it's for our students with disabilities, our students without disabilities. If a student reports something to a particular individual, or a particular individual, they see something when they query it, it's for whatever reason, it gives the impression that the child was being harmed, then the district has to they have to call DCPP, they have to report it. And what happens is it's the individual who was first notified that has to do the reporting. So it's not like, so let's say, for example, a student, like, let's say I'm a paraprofessional and the student that I'm assigned to comes up to me and tells me, like, I don't know, I don't want to say something, but like I was beaten or like burned, like, with an iron, my mom, and, it was something that wasn't accidental, whatever. So then I then have to call DCP&P. I can't go to the nurse or to my principal, or I have to alert them, let them know. But by law, I have to contact and let DCP&P know. And yes, I think that it poses a problem sometimes with some of our students, because like maybe they may not understand or may be aware, maybe the way they may have communicated it to that individual may not have come across correctly. But I don't want to say it's we have to err on the side of caution that this something may be happening. So this is something that we cannot, like, we have to report it and then alert the principals, etc. But I would say that if this is something that's like ongoing, let's say the same family, what have you, DCP&P worker, like when they come out, they investigate, they may or may not take the case. So like if they take the case and there's something more untoward going on, and then but then, and likewise, if parents or guardians suspect abuse from your child, you have the right to call DCPP. There's a sub-agency, institutional abuse, or from anyone within the school setting, if you suspend, that's happened, as well. So, like, I do understand sometimes how it may be frustrating to parents, especially if they're constantly being contacted by this agency for something that's not abuse. But unfortunately, like, there are too many situations and occasions where it ends up being abuse, and we have children that die as a result or what have you. And so by law, we do have to report.
I have a quick question.
Yes.
I have a question before your question. Sorry, that was my question.
No, I'm sorry.
And the way it was eventually found, so I was missing some context.
Okay.
For example, this is one of the many calls that happened to us. My 6-year-old trans autistic daughter,
okay,
is what she even before she identified as a girl, she dressed a lot in pink.
Okay.
Her teacher over the year was increasingly frustrated that I wasn't dressing her in more boyish clothes. So she had a tiny scratch on her arm. The teacher got the school nurse to say it was a burn. It was categorically not a burn. Like, no credible medical professional would have said it was a burn.
Okay.
I actually got a doctor to verify, a very respected doctor, that it was not a burn. Okay. But in the meantime, we were called, we had DCP&P unleashed on us. Right. And they don't come expecting to just keep an open mind and be, they basically like swoop down on us and like, you have left your child unattended by a hot stove, which never happened. And so, I mean, that's one example of a concern that was framed as medical neglect in order to ensure that an investigation would take place when really the teacher was upset about the gender presentation.
That sounds discriminatory to me.
Yes, it is. But
That's a DCP&P issue. Well, not unless, but certainly a teacher discrimination.
yes,
Yeah.
most definitely. But things like this occur every few weeks to few months for us. And
Where
always,
DCP&P came back into the.
yes, and the problem is DCP&P is not equipped to recognize special needs, and especially the manifestation on the environment. Like I have 2 autistic kids living at home. My 8-year-old, non-speaking, untoileted, very distraught with the home environment. It's not possible for I'm a single parent, one person to keep up with the home maintenance, even though I basically like cleaning myself into a really great trying. But DCP&P takes one look and is like, Mom, you got to do better. Like they have no capacity to understand what's going on. There are no, they don't, I know school staff may imagine that, at least they can hook the family up with resources.
Right.
There are no resources to address this. We're already under-resourced as a population. And the thing is, DCP&P they will, like, just, even if there is no cause for the actual call, other than the school staff wants to rule out abuse, what's happening is that when you're called this often, you're automatically bumped into a high risk category, and it's impossible to get them to go away.
Okay.
So what school staff are essentially doing, for preemptive reasons that wouldn't prompt a call in a gen ed population, for example, for CYA reasons, maybe they didn't take action, something bad happened once, or for bad faith reasons, like, the parent doesn't like how the kid dressed, the school doesn't like how the school staff don't like how the parent dresses the kid, which happened to us, or, and like any of these types of situations, basically in the name of preventing abuse, you're subjecting disabled families to perpetual abuse. And I understand it's a very difficult position for school staff to be in, but there has to be a solution other than, just to make sure we will severely hinder these families' ability, these families who are already under-resourced and under-supported, to actually go about their lives and parent effectively. So
it's come up numerous, it's not just her situation, it's come up and so just, maybe even having a I don't know, lunch and learn, or part of the training for the teachers to explain, obviously you don't want to put any child in jeopardy, but to be a little more circumspect when talking about children with disabilities, who are often, in vulnerable situations already. So it's very tough. It's very tough because you want to make sure that they're safe, but these kind of things can,
I know in the past, like several years back, we actually had representative from DCP&P, then DIFIS, come out and speak to staff members in terms of when to report and things like that. There may be something that we can look into again, like another training.
that would be great.
Yeah. Yes, I just.
Okay, we have a quick question.
So quick, thank you guys, and Dr. Trim, you're amazing. School tours coming up, Buzz, is there a way, I did the tour quickly last year, there were students giving the tours, which is great if you're neurotypical. Is there a way for someone to give the tours to a parent who need to see like the resource room and focus more on a special ed lens? I know Caitlin gave the Glenfield tour, which was so helpful, but there was no one for Buzz.
Okay.
If someone from the Buzz team or anyone who,
we will make that happen.
Thank you, that's amazing. Because it shapes the IEP from a parent's perspective.
Absolutely. Yeah, and there was one more, I just want to read this last one that came in a little bit late yesterday, and I think I sent it to you, but I may not have. Sorry. Okay. When a district is unable to provide a student with disabilities a free, appropriate public education within district, how does the district determine when an out-of-district placement is required, and how are those decisions insulated from budget pressures? And part two, when staffing changes occur, how does separate question, but how does the district ensure that students with IEPs continue to receive their services, and what oversight exists? I think you answered that already with but what oversight exists to catch and correct breakdowns when they happen with this? I think you covered that as well.
Right.
Okay, so
Yeah,
the first one,
yeah.
who makes the decision? Like, how does the district determine when an out-of-district placement is required, and how are those decisions insulated from budget pressures?
Yeah.
Because I think that's a lot of people's concern, that
the budget.
with this crazy budget
Yeah.
situation.
I'm gonna be honest with you, we have not taken the budget into account when sending our students out of district. Maybe we should, but we have not. Like, as a department, if we cannot meet the needs of our students in district, then the team will. And I tell you, the child study team members that we have, they're true advocates, because even if myself and the supervisor, building administrators may say, well, no, well, we don't think the student should have this, why don't we try this? And if they are of the impression, well, no, the student needs greater supports, then they're going to stick to that. So ultimately what happens is that's a decision made by the child study team, right? The child study team members will review the data, and make that determination based on the programs that we have and the supports and services that we have in district. And if we don't have it, if we cannot appropriately support the student in district, not just in that school building, they'll then look at other schools that may have additional services or different supports, or greater supports. Like, say, for example, we talk about Renaissance and the study skills period, they may not have as much time or hours as other middle schools. Then the request may be made, okay, well, you know what, Buzz Aldrin has this class, or that may meet the students' needs, or Glenfield, or what have you, and they would make that recommendation. But it's everything. It is data driven, and it is a child study team decision. Now, the child study team member or case manager rather would say, like, we think that the student would be better off in an out of district setting, and then the supervisor administrator may give pushback and say, well, did you exhaust every effort? What did you try? What about, did you overturn this stone? Only because, first of all, we always try to provide the LRE was the least restrictive environment. And LRE is different for everyone, right? I mean, there's one LRE, like, generally speaking, like, which is inside of the general education environment. But for a student who may be in a self-contained class in district, that may be their LRE, that may be their least restrictive environment. And out of district program for other students, that may be that student's least restrictive environment. But ultimately the recommendation is made by the child study team using data. Now the team will then speak with the supervisor and say, listen, I don't think we have this program. And then the supervisor may say, well, you know what, like, did you try a behavioral plan? Did you try maybe professional supports? Or we have this program, we have a MAP program. This is for a student who's ERI. We have a MAP program over at Bullock. Let's try that first, because again, every in-district program is the least restrictive of environments. And whenever possible, that's what we should push, the LRE. And this is because in districts, like, you have students have the opportunity to model appropriate behaviors set forth by their neurotypical peers. Like, when you're out of district, it's it's restrictive. But again, sometimes of our students need to go out of district, but it's more restricted, and students don't have the same opportunities in an out of district program like they do in district. But yeah, ultimately it's the child study team members will make the decision based on data and say, listen, we've exhausted all programs and strategies that we have in district for the student. Yes.
When the child study team is looking at data, is there a component of the data that addresses social issues, not the child's behavior, but the environment that they're trying to survive in? And I would use the word survive.
Yeah. Wow. So that is absolutely social issues. That is a factor. It is a huge factor, but it's not the only factor. Like, we have to take into consideration, like, academics, like, first and foremost. But yeah, social like awareness is definitely a factor. So let's say, for example, if it's I'm just using our self-contained, like maybe our MAP program or our ASD classes or program. If we don't have one like that's in district, like, and let's say it doesn't rise to, it's not as good, right? Or take that back, it's not as effective for that student as a program out of district may be, then ultimately we refer to student out of district. We've done that for several students, like in our ERI programs, like if in district, like we cannot meet our students, the needs of those students, we'll say, and it's like, listen, like right now, the school, like we don't have the supports, we don't have the counseling supports, we don't have the, like a full-time behaviorist on staff, or like we've tried this, we've tried paraprofessional, we've tried numerous behavior plans, like this individual may need a more therapeutic setting. So we absolutely have referred out in those types of situations.
And that is still going on despite the budget.
Still, despite we have to, despite the budget issue.
Thank you.
And I just want to throw out that Ms. Stafford, my son is Cliff.
Yes.
Ms. Stafford was one of the highlights of his interview. He's a sophomore at Rutgers. But going back to your point of we want kids to contribute to society, he is academically dialed in.
Nice.
And he has not made one contact at Rutgers. And so the social piece from kindergarten up is huge. He's not bullied, he's just ignored.
Oh.
So that piece is the key.
It is.
Greater
It's
than
huge.
academics. Contributing to society.
Yeah, we agree. And that just, when I saw you, I was like, I go to the doctor because I want to find out how you start. These are the things that we love to hear, right? Because the job continues to go on, and we want to hear about our students and what happens after they graduate and what's next. And it's just reassurance that well, your child is always dear to my heart, but that we have work.
Yeah,
we still have more work to
work.
do, and
Yeah,
I think
a lot of work.
it's very clear, and it's, again, I've said it before, we have to come together. We don't need to have a contentious relationship, the parents against us. That's not how we are as a department. I think CPAC can say that we're not like that, right? We want to work together. We might not always agree, and that's okay. We don't have to agree, but we still have the same goal, and we still want to do what's in the best interest of our students. Whether we agree or don't agree, sometimes we just have a different view, right? But it doesn't mean that we want to cause harm. So we just have a lot of work to do.
Yeah,
All right,
we do.
well, thank you so much.
That's
You've
it?
gone above. Well, it's 11:52. You can hang out. I wanna release you if you need to go, because we did say till 11:30, which was above and beyond, giving us an hour and a half of your time. We're really appreciative, and I think that we need to make this an ongoing quarterly,
Great.
thrice a year. But this was very helpful, and the transparency is
Thank you
huge,
for
because we
inviting
all
us.
need the trust of, we need to be able to trust what we're dealing with. We're a very
100%.
vulnerable population,
Yeah.
a lot of us, and it's very scary. These are our children. So thank you so much for being
Thank
open
you.
to doing this,
Thank
and we
you.
hope you'll come back. We know you said
Thank
you'd
you.
come back with Ms. Turner when she's available, and thank you everyone for showing up online and in person. It's really important to be here and to show that we care. So I really appreciate everybody making the time and effort to be here, which is not always easy. So thank you. I'm gonna
Thank
end the
you, online
recording.
people.
Bye, online people. Thank you.